Hi, good afternoon. I'm sorry that I'm recording this reaction for Dr. Vanessa's presentation because I'm still here in the Pulmo Convention. Anyway, I'd like to congratulate Vanessa for the very extensive and timely presentation on this case of pertussis. We worked hand in hand in the management of this case. We caught this patient at his catheteral stage, and the patient exhibited all the complications there is to pertussis, even went to sepsis and respiratory failure. Thereby, we had to intubate the patient. However, with the medications that were given, we had successfully extubated the patient, but still supportive therapy was given, since even though the patient was extubated at that time, the patient still exhibited the usual symptoms of the paroxysms of cough even after extubation. And these are expected until 10 weeks from the first day of cough. So what is to be emphasized on this case, since this patient is only a month old, the management of pertussis, prevention is still the mainstay and the most effective measures. Like for these patients, usually for the pregnant women on 27 to 36 weeks age of gestation, they should be given the Tdap vaccine. And for the children, usually we give this at 2, 4, 6 months, and then we should have the booster at 15 to 18 months, followed by another booster at 4 to 6 weeks old, 4 to 6 years old, and at 10 to 12 years old. So this patient, if we recall, was exposed to her sister, whose age was, I think, 10 years old, that was not given a booster. So I think that predisposed the patient to having the pertussis. And I still commend Vanessa for having the high index of suspicion in this patient. When we saw the patient initially admitted as a pneumonia, but eventually turned out that was having bouts of pertussis. So I think there's not much new updates on the management of pertussis, except that we have the PIDSP together with the PPS came out with a consensus statement which was presented by Vanessa. And basically for the diagnostics, it's still the swab which we have here, the PCR swab, but I'm not sure if how many days does the swab results come in. So it's still important that if we have a high index of suspicion of pertussis, that we start with a treatment right away. That there's not much loss if we start the medications. So I think basically that's it, and thank you. Have a good afternoon, everyone.